Welcome back, everyone, to OpenLine. We have with us Dr. Michelle Fiscus, pediatrician. She's also the program medical director for the Tennessee Immunization Program. We're talking about vaccines. And we have a couple people on the line, want to get to their calls, but you mentioned flu a moment ago, and let's drill down deeper a bit into flu. A lot of people will get every vaccine, but they won't get the flu vaccine.
Right.
What do you think about that?
Yeah, you know, flu, of all of the diseases that we can prevent, flu is the one that you are most likely to get. And so we hear lots of reasons why people don't get flu vaccine. One, it's kind of a hassle. We have to get it every year. We still don't have a long-lasting flu vaccine that will go from year to year. Not that they haven't tried, we just haven't found one that works yet. So it's it's a little bit of a hassle to get a flu vaccine every year. But what people need to understand is that we have had, just from October 1st to March 15th of this year, the CDC estimates that there have been 30 million illnesses from the flu. That's 1 in 10 people in the United States that have had an illness from flu. That's a lot of illness, and we don't talk about that. We don't talk about the fact that it causes 400,000 hospitalizations. We don't talk about the fact that there have been 40,000 deaths estimated just this season, or that when we had the swine flu back in 2009, the pandemic H1N1 flu, that there were more than 500,000 people that died in that pandemic. So getting a flu shot is critical, especially if you're very young or you're very old. But we have seen completely healthy 30, 40-year-olds who have been wiped out by flu this season and in all the other seasons before that. So don't be afraid of the flu shot. It's been around for decades. It has varying efficacy. This year it's about it prevents about 50% of flu cases. But if I had a choice of not having 105 fever and feeling like a truck hit me for a week, and getting the shot versus not, I will take that choice of a 50% reduction in getting flu vaccine. The shot cannot cause the flu. We hear that all the time. Oh, the only time I ever got the flu is the year I got the shot. Well, I often wash my car and then it rains, but the two things are actually not connected. So the shot cannot give you the flu. You need to get it, and if you don't believe in protecting yourself with the flu vaccine, you need to do it to protect the babies that are around you, the people who have cancer, all the elderly person that you might go to church with, that you shook hands with, all of the people around you that also need to be protected. Interesting. Okay. Yeah, and you hear, well, this year the flu vaccine was only, so effective. And so that is another reason I think people are like, well, is this going to be an effective year or not? But no matter what, you're doing better if you get it than if you don't. Absolutely. The only vaccine that doesn't work at all is the one that you don't get. That's 0% effective. So, even in a bad year, so we had a not so great year, the 2017-18 year. The flu shot was only working about 30% of the time. But even at that, it saved a projected millions of illnesses and tens of thousands of hospitalizations, and so even if it's a 1 out of 3 chance that you're going to prevent the flu, take that, and chances are if you do get the flu, you're going to get a less heavy case of it and not be as ill. All right, let's go to David. Hello, David.
This is James.
James, I'm sorry, James. You're right. David, you're coming up next, but James, go right ahead.
Well, good evening and happy spring. This has something to do with vaccinations, inoculations. I was born in 1948 in Detroit, Michigan. I vaguely remember at 5 years old getting the sugar cube pill for polio. I remember one of my best friends, it was about 1954, and he was an iron lung on a front porch, and I could not go up, sit with him, and I smelled the liniment and heard the loud sound of the iron lung keeping him alive. So my message is to new parents, get your vaccinations for your children. Even though polio is pretty much eradicated, don't take a chance on their life.
All right, James, thank you very much.
Thanks, James. Yeah, it's people who lived through that time will not soon forget that their parents wouldn't let them go swimming for fear of contracting polio. I mean, very real fears. And I know survivors of polio who I actually attended a lecture in Alabama a couple weeks ago from a survivor of polio, and that was a very real and really terrifying disease, and people lined up to get that vaccine, as they do in other countries where we still see polio. So it's really important. A very quick funny story, I also got the polio vaccine on a sugar cube, and my mother reminds me that it took 5 people to hold me down to get me the polio vaccine on the sugar cube. And so whenever I said something about a pediatric patient, my mother told me that was karma coming back to bite me from fighting my polio vaccine.
Wow, so you were against it. Okay, that's interesting. All right, let's go to David. Hello, David.
Hey, Ben.
Hello. Go right ahead.
Hey, yeah. I want to get not really political about this, but the legislatures up there on Charlotte Avenue, they make all these laws. And they do this, good intentions, all that kind of business. They want to show that they're protecting the people. What are they doing about the people that aren't following the law? It's part of the law. Before your child enters school, you've got to have certain inoculations. We know where all this is coming from. We haven't had an outbreak of measles, mumps, rubella, chicken pox, whatever it is. We haven't had this in years. I know the last 50 years. In the last 5 or 10 years, it's been a big, all over the country. Nobody's following these laws. Nobody's forcing these parents, well, God is going to protect my child and going to cure my child of this and that. That's not going to happen. I understand that, and being religious is great. But the bottom line is these kids got to be inoculated. We did in the 60s. You know, when I started school, we did like you said, the sugar cube and with the polio and all this. We didn't have all this outbreak. We know where it's coming from. You call me what you want to call me, but we know where it's coming from. And it's got to be dealt with. And, you know, you guys that work with this stuff, y'all should be the big push to the legislatures to make sure that these families do this, not just to push your weight around or whatever, but we got to have these kids inoculated. People have to be inoculated. We can't send people to school and expose our kids, whether we got the inoculation or not. They still don't need to be exposed to it. But my point is the legislature needs to make consequences for these people that don't want to do it. It's got to be done. We don't want to spread this. We don't have any outbreak until the last 5 or 10 years.
Right, right.
So, you know,
yeah, well, I like that. Let's talk about it. Thank you very much. Thank you for the call. What about that? So he's sitting there saying, why don't the legislature just mandate this? We know where this is coming from. You know, what about that?
So there's only a couple of states in the entire country that have outlawed religious and philosophical exemptions. So that's Mississippi, if you can believe it. Mississippi has better immunization laws than we do in just about any place in the country. Not to disparage anyone from Mississippi. West Virginia and California. Those are the only 3 states that have medical exemption only laws in the entire country. So every other state in the country either allows religious exemption, philosophical exemption, or a combination of the 2. And so David's point is well taken, that as long as those options exist, people are going to take advantage of them. And personally, I feel that when those options exist, I think it allows people to question the science. To say, you know what, these exemption opportunities wouldn't exist if they were really confident that vaccines were important and that vaccines worked.
The political will isn't there right now to do that. Is that true or not?
I don't know what the political will is in Tennessee, but certainly we do have religious exemption on the books in Tennessee, and if the will of the people is to change that, then they need to contact their legislators. And
I was fascinated by what you said, and it bears repeating. What is the religion that is opposed to vaccines? Is there a major religion that is opposed to vaccinating your children?
The only one that I have found is the Dutch Reformed Church, which I understand does not exist in the United States. So people will say Amish, that is not true. They don't have doctrine against vaccines. The Jehovah's Witnesses do not have doctrine against vaccines. So I don't know.
So there's no, Catholics 100% for vaccines.
Absolutely.
The major religions are, as far as you know, you study this more, they're for it.
Right.
So it's very interesting. I think that's fascinating. All right, we're going to take a break. If you're on the line, hold on. There are a couple people on the line. We'll take a break. Be back right after this.